I believe we are live, everyone. Hello, everyone. This is Dr. Vivian Asamoah. If you are watching this, well, you may be on our private Facebook group. You could be seeing this on YouTube. But if you are, please feel free. If you're watching this on the replay, please feel free to type in replay and give us a shout. We do this every Thursday night. Let me start the introductions one more time. My name is Dr. Vivian Asamoah. I am an integrative gastroenterologist based in Katy, Texas. That is West Houston. My practice is a little bit different. Ooh, we got a replay. My practice is a little bit different because we try to blend the best of both worlds. I'm a board certified gastroenterologist, trains at Johns Hopkins, and I also love the practice of everything that is what we call functional medicine, integrative medicine, holistic medicine, Renaissance medicine, precision medicine, whatever you want to call it. But really, it is bringing in sort of that more natural, holistic, but also a lot more forward thinking medicine that looks at root cause. And we stream live on Thursdays at 6:30 in our private Facebook group called Natural Gut Relief. And we just talk about everything that's related to gut health in terms of prevention, diagnosis, and treatment, and finding natural ways to relieve gut issues, very holistically. And this month, we have been talking about this. In March is colon cancer awareness. So we've been bombarding you guys with information about colon cancer. And this is, of course, as you know, as a poop doctor, this is a very, very important topic for me. We started off the month by talking just of bringing out the awareness, talking about getting tested, what kind of tests to do. The second week, we talked about natural herbs and remedies that have been shown to maybe reduce the risk of colon polyp formation, colon cancer risk. We talked about things like berberine, curcumin, green tea. We talked about the importance of vitamin D. And none of these prevent colon cancer, right? But we know that they can potentially reduce the risk of, right? Prevention comes through screening. And that really has been our focus throughout these months. And I have a very special guest tonight. We often have wonderful guests on Thursdays, and they're often nerdy doctors like myself. But today we have a guest that I think all of us will be able to relate to. She is one of my patients, a dear patient of mine. We've been working together for many years. She schools me in many ways about different things. But what I love about Elaine is her joie de vivre. I follow her on Facebook as she travels the world to France and learns painting. And she's in Italy and she's in Australia. And did we do South Africa, Elaine?
Not yet.
Not
Iceland.
yet. Okay. So you can see I follow her. I follow her whereabouts. But Elaine is a colon cancer survivor. Elaine is a colon cancer survivor, and I have shared this journey with her over the years. And today I thought it was really important for us to put a face to this disease, really, because some people are like, well, it's not going to affect me; it will affect somebody else. But Elaine looks like our neighbor, our best friend, someone's grandmother, right? Someone's mom,
Right.
someone's sister, someone's sweetheart, right? And so this really tells us that colon cancer can affect anybody. And I have been harping on and harping on and harping on. And I don't think anybody, I hope everyone's listening to me, but I know that you will listen to Elaine. So, Elaine, thank you so much for joining us this evening.
Well,
Um,
thanks for the invitation.
you're so welcome. And let's start off with I actually want to start off with one question. Tell us something. Now we know you had colon cancer. We know that. But tell us something about you that most people out there may not know or guess about you. Something interesting, funny, anything. Tell us something because I know there's something.
Well,
There's a lot.
my career is in public relations and assorted varieties of that. But my first job, besides working in a candy store when I was in college, I was Miss Fluffy Rice.
Miss Fluffy Rice.
Yeah. hmm I worked with American Rice Council, and I was the one responsible for sending out cookbooks and recipes, aprons that said "Have a Rice Day," "Rice and Shine." So not many people know that.
No, no. Wow, that is so interesting. Wow, exciting. Well, nobody knows that. Nobody knows that. So thank you for sharing that. Thank you so much. And so we met a couple years ago, right?
Four.
Four now. And I love working with Elaine because we kind of went the conventional route and then we did the functional medicine route as well. We were like, okay, what can we now do in terms of diet and nutrition to prevent disease? So it's been an awesome journey, and we're still working together because there's new discoveries and there's, I'm trying to fix this and I'm trying to fix my cholesterol. But tell us about your initial, when you first started having like gut symptoms or GI symptoms, what prompted us to get that colonoscopy?
Mainly it was just, I just had a little bit of bleeding in my stools. Thought I had hemorrhoids. In fact, I told Dr. V I probably had hemorrhoids, and she said, well, let's check it out. And that's how we started.
How long did you have the bleeding for?
I would say maybe 2 to 3 months.
Okay. And was it bleeding every day and
No,
was it a lot of blood? Okay.
No.
So it was just kind of like when you wipe, you saw a little bit of blood, a little bit of staining, and that was it, right? So I think a lot of people would relate to this. Like we see a lot of people coming with just like, oh, I just a little bit of my on my toilet paper, a little few drops here, and some people just assume, like you did, that it was just hemorrhoids, right?
Yeah.
Yeah.
And it was time to get a colonoscopy, so I asked. I have kidney stones frequently. And so I asked my urologist for a recommendation, and he recommended you.
Oh, I know your urologist. He's a really cool guy. I like him a lot. Okay, so we went ahead and we did this colonoscopy, and this was not your first colonoscopy. You had had one before.
Right.
Right? And so the one prior to that was it many years before? Was it over a decade?
Yes, it was. I mean, it was time to go back in, and you just kind of hesitate, and finally you go, well, let's go get this done.
So you had one. Yeah, so you had one before. So I also want to highlight that just the fact that you've had a colonoscopy in your lifetime doesn't mean that you will never get anything again. Like you will never have polyps, or, you're free from potentially having colon cancer. This is someone who had a colonoscopy. Elaine had her colonoscopy in her 50s, 60s. Back then we were doing it at around that age. Now we're doing it at age 45. But then 10 years later, when we did the colonoscopy, we diagnosed colon cancer, right?
Well, actually, I was 72.
You were 72. Yeah. Wow. Yeah.
So, you think you're past all that,
Yeah, absolutely. Absolutely. So you had it done, and I unfortunately had to give you the bad news. And how did you feel? Like, what was your reaction at that point?
Well, let me tell you, I walked in that morning just for a colonoscopy. And when I walked out, you were smart enough that while I was there, well, you've got cancer. Let's go get a CT scan while you're here. And so it looked like it had not invaded the other organs. So I walked in knowing I was just going to get a colonoscopy, and I walked out knowing I had cancer, and it had not invaded to the best of the knowledge of the test. So that was a big 2-3 hours there.
Yeah. So we did the testing quickly. So we started, once I saw what it looked like on colonoscopy. And sometimes, as gastroenterologists who've done this, we've done thousands of scopes, we can tell when something is cancer, right? Most of the time we're like, this is highly suspicious. Let's go ahead and start the staging process so that by the time you see the next referred doctors, usually a colorectal surgeon and oncologist, we have some idea of what we're dealing with. So I usually get started really, really quickly and say, oh, let's do the imaging, let's get some labs, let's get all of this, and let's get a sense of things. So you had a sense of, okay, this is what's going on, this is the next step, right? And so let's talk a little bit about after the colonoscopy and when you got home. How did you tell your family? Did you tell your family? Who did you tell?
I
Did you?
didn't tell them immediately because I wanted them all together. It's not something you want to talk about by phone.
Yes.
So I'm single. I have a sister. I have a daughter. So I
Mhm.
waited until the time we could get together. In the meantime, I had asked you before I even left. I said, "See if you can't find me a way to get into MD Anderson."
Mhm.
I had a background. My family had had some cancer along the way, and I just knew they were good. And you did, and I really thank you for that. But as far as telling the family, we were all like, well, we'll just get through it.
We'll get through it. Absolutely. Absolutely. So we moved kind of quickly. I remember we worked with a really great colorectal surgeon. What was his name?
Dr. Matthew Tillman.
Tillman, exactly. And he did a great job. And you started there. Did you see an oncologist, a cancer specialist as well at MD Anderson?
No, I was probably very fortunate because when he did that surgery, although they had to take a long section out, about 18 inches, he
No.
took out 48 lymph nodes and not one of them had cancer. So between that and the blood test and everything, I did not go through chemotherapy. I was ready to mentally,
Yeah.
but no, I didn't have to.
So such a blessing,
Stage one.
that stage 1 colorectal cancer, caught early, with Elaine, 72 years old, had a colonoscopy before, and was only having just a little bit of bleeding. No pain, no change in bowel habits, nothing like that. Just a little bit of bleeding, right? And
Right.
so went through surgery. And let's talk about the surgery a little bit. Like, when they explained the surgery to you, what did Dr. Tillman say in terms of what were the risks of the surgery? What was recovery going to be like? Were you concerned? Were you worried?
Of course, you're a little apprehensive of the unknown, but at the time he was very good. And I had a what they call a robotic surgery.
Oh yeah.
And so when I came home, I had 7 incisions, 6 little ones and 1 big one where
Mhm.
they pulled the gunk out, you know.
Mhm.
And so my circumstances were a little bit different than most people because the day I went in was March 18th,
Okay.
which is the day they started shutting down the world for COVID,
Oh
including hospitals.
wow.
So that meant no visitors, no anything, which was fine because you're so concerned about getting through that first initial stage.
Yeah.
So I got kicked out a little bit early because they were shutting the floor down and they were completely devoting MD Anderson to their COVID patients.
Mm-hmm.
So that was a surprise. So when you came home, the world was shut down.
Yeah. 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 So you were home kind of alone, really.
Well, I had a nice sister that
Okay.
came and stayed. Ironically, my daughter had just had foot surgery, so she was in a boot, but determined to come help. I'm not sure how that really worked out. Her helping, but they were there. They were there.
It's the thought that counts. She was present. She was
Right.
present. Yeah.
Right.
Oh, that's good. That's good. And what was the recovery like at home from the surgery?
The recovery, and that's one thing when you go into this. I didn't know anybody that ever had colon cancer,
Yeah.
so I thought when I started talking about it, people would send me notes. Oh, I had colon cancer in my 20s. I just finished my 5th year. I was, So all of a sudden, here were people I knew that nobody ever talked about it.
Nobody talks about cancer, though. Nobody generally talks about it. Yeah.
That's right. So I felt kind of alone until I found others who had gone through it. But and everyone's story is different. Mine's different than the next person's and the next person's and such.
Yeah.
So during that time, I couldn't have visitors and I couldn't go out. Not that I was going out anywhere. It took a little bit to get over.
Okay.
It took me, in fact, I had healthcare come to the house to help me with some physical therapy.
Yeah, because you were rehabbing at home. Someone just posted you had to rehab at home.
Right.
Yeah, yeah. Oh, wow. So when do you feel like you got back to yourself? Like, able to mobilize, move around, and
It was probably a good 2 months, 6 weeks, 2 months.
okay, okay,
With that, because you're tired,
hmm
you don't have the energy,
hmm
you're eating a little bit differently,
yeah,
you're trying to get your system to work and it doesn't work.
right.
So
I got
yeah,
you. I got you. So wonderful. So what insights, Elaine, having lived through this and having been fortunate enough to have we have caught this very early, gotten the best care at MD
right.
Anderson, right? He was very thorough in taking out 47 lymph nodes and making sure that this was a stage one. You did not need chemo. And as you say, everybody's journey is different. Everybody's cancer story is very different. But what would you like to share with everyone listening to us out there about any insights or advice about someone navigating a similar diagnosis, or maybe supporting a loved one who's battling colon cancer right now, who's struggling with the diagnosis? What
you,
would you
you you
share?
find that a lot of people don't know what to say,
Mm,
uh, so you may have to be the one to start the conversation. You may be the one that if people said, well, call me if you need me. Well, I need more than that.
yeah,
So you have a list. I've made list of lists. Have a list of things people can do, such as a specific food. Could you bring me a certain? That's when I could eat pimento cheese or a sandwich or something and
yeah,
stay and have. Well, they couldn't stay at that time because
yeah.
everybody was so isolated. Um, Share a book. I need somebody to go to the pharmacy for me and just drop it here at the door.
Hmm.
Um, anyway, come stay with me and give my sister a break. That was a lot of it. So because she was here and she needed a break away from all of this and such. So
Ask for help is what I have you be specific,
right,
you
right.
know? Yeah.
And I think before you even go into it, I had make lists, books to read, things to appreciate,
Mm,
things to do when you're still well, things to do when you're afterwards. I just, you know,
yeah.
start your own conversation.
Dr. I love
Yeah,
that.
and give yourself a little grace. It's okay to be cranky.
Yeah.
It just may, it's just going to happen. It's
Yeah.
okay to really look bad. It's really, it's okay. So give yourself some grace.
Give yourself some grace. I love that as you're going through it, right? And I love the fact that you said, even when people said, "How can I help?" having them come to help so that your sister, who was your caregiver at that time, could have a break as well, could go off and do whatever while it was
Right,
COVID time,
right.
but could at least get a little bit of caregiver break at that point. That was really, really important. That's really good. And has your perspective on life changed? I mean, your perspective in terms of how you take care of yourself, given the
Well,
fact that
as you said, it's an ongoing journey. I'm still with you. We're still working out, bugs in the system every so often. And
yeah,
I think folks need to realize they may not ever be quite the same, but
yeah,
it's okay. I always reckon myself. I mean, when I leave this earth, I'll probably be hit by a bus, but it wasn't going to be cancer that took me out. You know,
you're gonna
um,
fight that all the way. It was not gonna be cancer, huh?
Right,
Yeah.
right. And nobody knows how many days you have. So my model has been while I'm still walking. So while I'm still walking, I might as well be serving at church. I might as well be doing this. I might as well be helping someone else. Um, and so since then I've been able to travel.
Yeah.
Since I got past COVID in my situation, I've
Mhm,
been, like you said, Australia, New Zealand, and stuff. I've taken painting courses.
mhm.
I've done online courses, a lot of enrichment things because I
You
could
feel
be hit
like
by a bus.
do you feel like after you got the diagnosis, you started doing more of that kind of let me live my life now, or have you just always been this person?
I've always been rather upbeat, but one of the things I did do a better job at was getting my files prepared. you
Mm,
know
mm,
do my kids know where certain things are? Do they know this? Do they know that?
Yeah.
Financial, I'd already done that, but just some things that I thought, oh, and here's about me they may not know. I
Mm.
started writing a book.
Oh,
Except it's just a book it's an online thing called Storyworth. And
okay.
they'll send you questions
Uh-huh.
about your past so that it may be something you leave behind or share or whatever when you're ready about you and your story. And that's been a fun thing to do. When you finish it, they bind it and print it for you, and you have a gift for the family.
Oh, what is that called? Storyline?
Storyworth.
Story words. Words?
Worth.
Word.
WORTH.
Story worth. Oh, I love that. I'm actually gonna post that. I think that's a beautiful thing
Yeah.
to do.
I
Yeah.
think it runs about $99.
Okay. Okay. And
But
then
they give you like 40 questions, and if you don't want to answer it, but mainly about your grandparents or your background or how you grew up or what your impressions of certain things were. I was a teenager when the Beatles were around.
right.
So things like that.
Okay. Beautiful. Beautiful. I love that. Okay, so tell me about your nutrition and lifestyle, because I know we talk about that quite a bit, right? And so how has your diet changed? We've posted in the past how we know that red meat may increase the risk of colon cancer, right?
Right.
Going more
Yep.
on a plant-based, focusing more on a plant-based diet and less processed food may definitely. How when you got the diagnosis, what changed for you in terms of nutrition? What did you change?
Well, I'd already been on the not as much beef regimen because of having kidney stones. And that's what that doctor had said, like, lower that beef. You don't need that. However, if I feel like I want some beef, I'll eat the beef and then I'll get over that urge and keep on going. I'm a big fan of turkey and
Okay.
ground turkey for tacos and, casseroles and things like that.
Uh-huh.
During some of the testing with you, we've discovered I'm lactose intolerant.
Uh-huh.
Never dreamed.
Right.
So I've adjusted things around that.
Around your diet.
It's that ice cream, but hey, I don't miss having that bloated feeling. So,
Okay. That's good. That's really good. Okay. So, and then what about plant-based fruits and vegetables?
well, adding more breakfast is tough for me. So I've tried to put more fruits with breakfast. I'm not a big oatmeal fan, so I use rice and then I have fruits and I have yogurt that is coconut water based. I've always loved that, so get around the milk part with that. Try to have HEB has these wonderful little simple meals, and you can get for like a single person a piece of salmon, and they'll have asparagus with it,
Mm-hmm.
and it's sometimes almost
Redone.
enough for two
Right.
meals and
Okay.
such.
Very nice. And since you live alone, that kind of that little smaller portions, right, with the asparagus,
Right.
the salmon, you can tolerate that. What was your diet like before? Someone has a question of what was your diet like before the colon cancer diagnosis?
Mm, I liked hamburgers.
Mhm.
You know,
Eating. So that's
processed foods.
that was
I ate some
processed.
processed foods.
Yeah.
As we've had conversations, a lot of my particular cancer might have been from maybe processed foods and inflammation, and it just
Yeah.
snowballed after that.
After that, yeah. Okay. So there's been quite a bit of a change, right? You're trying to really clean up.
Yes, and I'm a work in progress. I still need to do
We
more
all
of it.
are. We all are. We all are a work in progress. We all are. What do you think, Elaine? And I'm sure you have some thoughts about this. We recently changed, I think about 2, 3 years ago, I believe, the guidelines where we're starting to screen our patients at age 45 instead of age 50. The new age for screening for colonoscopy is age 45 right now for men and women the
Yeah.
same, right?
I have a daughter in that age range. She hasn't gotten her colonoscopy yet, but I think they went the Cologuard route.
So
So
call me. No, she can't go the Cologuard route because
I
her
know. I'm
mom
still working on it.
has colon cancer, so she can't do that. She does not
Right.
qualify for Cologuard. She absolutely must have her colonoscopy,
Yeah.
right? Yeah, absolutely. So we are scoping, we are doing the testing and the prevention much earlier. what are your thoughts on that? Any idea why? Like, how does that make you feel?
Oh, I think it's wonderful.
Okay.
If people start looking sooner, this doctor had an MD Anderson, and I'll tell you a quick anecdote. I asked him why he got in the business of this particular being
Colorectal.
specific. Yeah.
Yeah.
And he said, one, because it was such a glamorous job. Two, he had some great mentors. But three, he said, if we get it early, he said, I get to see my patients again.
Oh,
they keep living.
yes.
So that was his main thing.
Yes. Absolutely, absolutely. So how many years out of the diagnosis now?
4.
4. Okay, so you're about to hit that 5-year mark, which is a very important mark, right? When it comes to
This year's another colonoscopy. So
yes, absolutely. And I don't want to keep you on for too long, but you've shared so much information. So much information. I love her. She's just a wealth of just positivity, encouragement, lives life. But if there was one last thing you could share with people out there today, right? Share with people out there who, for whatever reasons, right? Whatever reasons, as you say, the reasons why people don't want to get tested, they're various, numerous. Everyone's journey is the same. This is not a question. I just want you to speak very freely, but I want you to share a little bit of what you know to someone out there who may be thinking about, do I need to do this? Do I not need to do this? What if, that just tell us, share whatever you want to share, Elaine.
Well, I don't know the percentages of the colonoscopies that you do of when you do find signs of cancer. But, that's always a possibility. And I think people run scared because of that. But you can live through it. You do live through it. You have full lives. You just may have to change a few things, and maybe you don't. But yeah, and again, too, I think be kind to yourself. Give yourself some more life. Go get that testing done.
I love that. Give yourself some more life.
Yeah.
Get tested, right? Prevent whatever you can prevent. And if it is there, deal with it, just like Elaine has. Live through it so you continue to have a wonderful life right after, right? After you've dealt with it. Elaine, this was wonderful. We have so many comments from patients and from everyone out there in the group. Thank you so much for sharing your story. Right.
Well, if just a little bit helps, I'm happy to do it.
Thank you very, very much. We appreciate you, and we are grateful for your life. We are definitely.
I'm grateful for you.
I'm grateful for you. Elaine, you have a wonderful Thursday evening. Thank you for sharing this with us. And are you going to have dinner now, or are you already done with dinner?
Well, those little HEB meals. I've got one with salmon and asparagus ready.
That's good. Well, you enjoy that. Thank you so much. And everyone, we thank Elaine. Definitely put some love and some lovely shout outs for Elaine in the comments. Took a lot of courage to come and speak with us this evening. Took a lot of love and appreciation of our group to come and share her story. So we thank her dearly for coming on. Again, my name is Dr. Vivian Asamoah. I'm an integrative gastroenterologist here in Katy, Texas. We practice a different kind of gastroenterology care, blending the best of both worlds. Conventional, yes, we'll do the screening, we'll do the testing, we'll do the CT scans and what we need, but we also want to incorporate that more holistic integrative component where we talk about focus on nutrition, lifestyle, and lifestyle. Elaine, one thing I can tell from you is, I don't feel stress. I think you have a very good way of managing, controlling, and coping with stress, which I think is a huge plus when it comes to managing disease and managing chronic disease and inflammation. So that's wonderful. That's really
well, it takes a lot of faith also. I forgot to put that in. Give glory where it's needed.
Yes, absolutely. Give glory where it's due and needed. Have a wonderful evening, guys. Thank you so much, Elaine. And we will see all of you on another episode of Back to Basics next week. We'll be talking to a colorectal surgeon and looking at a colorectal surgeon's perspective on colon cancer and his experience with his patients. Bye-bye.